Hello everyone, you're watching sqadia.com and my name is Dr. Haematogenous and you are on today our lecture topic is infections. In our today's lecture, we will have 5 subsections. In the first subsection, we will be going through the general aspects of infection. We will be discussing how the microbes spread in our body, the classical features of infection, and we will be briefly discussing what is acute and what is chronic infection. In the second subsection, we will be going through a disease called as acute haematogenous osteomyelitis. What is its etiology and pathogenesis, its clinical feature, what are the differentials to acute haematogenous osteomyelitis, and its treatment. In the third subsection, we'll be going through the chronic osteomyelitis, its etiology and pathology, clinical features and imaging which is required to rule out chronic osteomyelitis, and then investigations and treatment of chronic osteomyelitis. In the fourth subsection, we'll be going through the periprosthetic infections, as nowadays prosthesis and total hip replacement, total knee replacements, it's going on at a very high level, and off and on there are so many cases being done of these knee and hip replacements on annually over the world. So we'll be going through what happens if the joints in those which have been replaced with prosthesis get infected. We'll be going through the general aspects and classification, etiology, biofilms of the organisms, clinical features, and treatment. In the last subsection, we'll be going through the acute suppurative arthritis. Although it's not very common, but especially it's common in children, and that's what makes it very dangerous because it can literally destroy the joint in days. And especially in child whose knee or hip joint effect has been destroyed, this could be disabling for life. So we'll be going through the general aspects and pathology of acute suppurative arthritis, clinical features and laboratory diagnosis, differential diagnosis and treatment of the suppurative arthritis. Thank you.